I'm Marilyn Serafini. I'm with the Alliance for Health Reform, and I'd like to thank you all for being here today. We are very excited to be having this discussion today. Everyone is so eager to, now that the election is behind us, we're all extremely eager to hear about what healthcare policy is going to look like moving forward. This fall, the Alliance for Health Reform kicked off the celebration of our 25th anniversary year. Today's conversation is the first in a special 25th anniversary series that we're conducting to inform the healthcare policy conversation and to advance the discussion. In 2017, in addition to our regular briefings and gatherings, we're going to be hosting a series of summits focused on the future of healthcare. And the first one is going to be on the future of health insurance. So stay tuned, you'll see more information coming about that. I'd like to take a moment to recognize our supporters for today's important discussion, Anthem and Health is Primary, which is a project of family medicine for America's health. I'd also like to thank the Kaiser Family Foundation for its use of the Barbara Jordan Center, which we always appreciate. So first, I'd like to turn the microphone over to Liz Hall of Anthem. She's Vice President of Federal Affairs and Director of Anthem's Washington office.
Thank you, Marilyn. If you first would join me in congratulating the Alliance on 25 years. It has been an awesome 25 years. Anthem is very pleased to support today's briefing. At Anthem, we work really hard to try to bring our 75 years of experience as well as our data to bear to help inform the policymaking process. And we really value the Alliance in that they provide thoughtful, thorough, and balanced information on the policy issues and proposed solutions at hand. So today's session is no exception, and I think I speak for all of us in saying that we eagerly await the wisdom and thoughts of those who will be speaking today. So thank you.
Okay, thank you. And now I'm going to briefly turn the microphone over to Ann Sable, who is co-director of the Health is Primary campaign.
Thank you. I know we all are anxious to hear about the outcome of the election. I just want to introduce ourselves and thank Marilyn. I work for the Health is Primary campaign, and we are a project of family medicine, and our aim really is to promote the value of primary care and talk about the need for a strong infrastructure of primary care. So obviously there's a lot happening in healthcare, and we, as you are anxious to hear what today's speakers have to say and are glad to be a part of this effort.
Great, thank you very much. Okay, so we're not going to delay any longer. We're going to start our first panel. Sarah Dash, my co-CEO at the Alliance for Health Reform, is going to moderate a discussion with Bob Blendon of Harvard. And if you would like to tweet along with us today, our hashtag is Health2017. Also, I wanted to let you know that we will have a video of today's event and also a transcript available on our website likely tomorrow. So there were a lot of folks who were interested in coming today. If you have colleagues, we will send this out to you, this information out to you, and you can pass it along to them. So for now, I'm going to turn the microphone over to my co-CEO, Sarah Dash.
Great. Thanks, Marilyn, and thank you all for being here. Before we get started, I do just want to take one moment to thank a very special person in the audience who is going to be totally embarrassed. Ed Howard was our founding executive director for 25 years. He's here today. Can everyone give Ed a round of applause? Thanks, Ed, for building such a great foundation for the next 25 years. We have a lot to talk about today. It's clear that the debate on how to create America's best healthcare system is far from over. And so to help us kick off that discussion, I'm very pleased today to introduce Dr. Bob Blendon. Bob is the Richard L. Menschel Professor of Public Health and the Senior Associate Dean for Policy Translation and Leadership Development at the Harvard T.H. Chan School of Public Health. And he is, as you know, one of our nation's leading analysts on public opinion and health policy. We're really thrilled to have Bob here today. And without further ado, I'm going to turn it over to Bob. Thanks.
Hi, Bob Blendon. I've learned from years ago it works better if you walk around, sit next to you. If you look really depressed, I'll sort of hug. have to sort of work our way through this together. I have been polling in health and social policy elections for years. Two things happened this year that were completely different, and I swear it's not my fault. In both, what happened was there were two elections, one in England, and we'll talk about that, and one here, where you went to bed at night, and the leaders of the country, the media leaders, and the leading pollsters all agreed that the election was going to go away different than it did. For that, it's just quite incredible to see that. And so I was in England for the first, and I'm going to talk about that, work my way through that, assuming that it could not happen in the United States, and we would know a week ahead, and we could go to bed early and not have to close it out with CNN or anything like that, and then to be around for the second round. And so the issue is I'm going to work your way through is my being and analyzing the work at Brexit changed completely the way I'm going to make my presentation today. And so I am going to look at the US scene quite differently than what I normally do, which is here's 18 policies and they like this and didn't like that, and that was important. Because when you actually looked at Brexit, it turned out that's not the way it worked out. If you looked at the policies, it was quite confusing. Some liked the European Union for 8 reasons and hated them for another, and experienced, it just had no for this. But before, the one thing in common, and I denied when I was in Britain this could ever happen, is a new demographic was created in Britain. And to be polite, it was called the other Britain. The demographic is non-minority adults who did not complete college, graduate school, or professional side, and did not live in a city. Not live in a city is very, very important. That group unbelievably turned out to leave the European Union. Unbelievably. It was not in any projection. The reason why I highlight that is demographically, it turns out they look like people in Michigan, Wisconsin, Pennsylvania, Florida, and Ohio, who turned out at unbelievable rates. We don't know the answer yet to who didn't turn out in the US. In the Great Britain, it was young adults. And as a professor, I had a problem not strangling ones that I ran into, because actually they were unbelievably in favor of staying in the European Union and managed to have a drink, go to get a beer, and didn't vote. So it's unbelievably low turnout of people in that. But what I discovered in the Brexit thing, and I'm going to run you through this very carefully, is that what explained the London vote, the English vote, is that people had a set of values about what was really important for the future. And also, they had an assessment, which could be factually quite wrong, about the state of the country at the time it was voted, based on what was important to you, your values, based on your assessment of the country, which this just totally disagreed between the two voters. You went there. So if I voted to ultimately leave the European Union, I was very terrified about immigration. That is the driving issue for people who left. For that, not only that, I felt that immigration to the UK had hurt my community. For that. Likewise, there was a backlash among those communities to the EU government, feeling that the rules that were set in Brussels were really hurting their communities and hurting British life. And that was dominated, exactly what it is. The reason why I totally stopped looking at policy issues are, at the end of the day, the people who voted to leave had no thought about what they would do the day after. They just wanted out. So all these, you would do this or that, or like this, and for them. On the other side, the people who voted to stay, who were in the majority, thought that economic growth was number one. Being part of the EU was number one. It had helped London, it helped these other places. It was there. For that, that's what they did. And also, which many of us could appreciate, they actually thought cultural diversity was a terrific idea. They liked cultural diversity. Couldn't understand what this immigration issue was about. But all the questions, did you like this, did you want that, would you pay for this after, would we adjust, it had no predictability. So I'm now going to take you back to the United States, and I'm basically just going to discuss 3 simple values with you. And I'm going to show how the healthcare issue actually is playing off these three simple values. My apologies for those of you who are in their 15th year of graduate study. You want to have more complex things than Professor Blendon is about to do. So this is a simple question. You can ask your friends, your relatives, do you think that the federal government should play a major role in improving health care in the U.S.? Could any question be simpler? So this is what happens. I say yes. Then you follow up a question and you say, how do you think the ACA is doing? Oh, it's doing well. And then I follow up and say, after the election, here are 6 options. 3 are positive, 3 are negative about the ACA. What do you think we should do? They say, oh, we picked the positive ones. Absolutely, we picked the positive ones. Not only that, I want to enlarge the ACA. And the last question is, oh, I'm leaving, I'm a pollster. Who are you voting for? You go, Hillary Clinton and a Democrat. Then I take the other side. There are actually a very large share of Americans who said, no, I don't think they should play a major role. So I said to them, how the ACA is doing, and we did this with Politico. It was before the premiums came out, so it's not premium shock. Okay, you said you didn't want to play a major role. How's the ACA doing? Awful, terrible. It's not working at all. Oh, the other crowd just checked one box. Okay, what do you want to do? The election's over, what do you want to do? So I'll show you the 6 scale in a second. The 3 are negative. Repeal, slice it back, give it to the states, and then have a tax credit program. Everybody who said not major picked one of those 3 options. There was no one on the other side. Then he said, oh, by the way, I'm a pollster. Tell me who you're voting for. Donald Trump. I'm voting Republican. Oh, one question turns out to drive every single answer for that. A subset of that. This is simple. This is a high school question. Very simple. Do you think the federal government should ensure that all Americans have health insurance? It's not a complex question. It doesn't have to be in a PhD exam. Turns out, if you say yes, you're a Democrat. It's say yes, I like the ACA. If I say yes, I don't want any option that doesn't expand. But it turns out if I say no, I'm a Republican, I want the 3 negative options, I'm going to vote for Donald Trump, and I basically went out of the ACA for that. So these are the values. And the third, many of us have gray hair here, but in 1973, there was a court decision called Roe versus Wade. There actually were a group of reporters who said at the time, now that the court has decided, we are going to work our way out of that issue. We are going to move on. Well, it's a bit later. And so it is the other value issue. And so I want to step back a second, and the question is just very simple. Do you think in America a woman should be able to get a legal abortion in most circumstances? Or how about the other side? Do you think in America a woman should not be able to get an abortion legally in most circumstances? Answer that question, and I'll tell you where you stand on Planned Parenthood. I'll tell you that if I say not get an abortion legally, I most likely voted for Trump and a Republican. And if I say that you should be able to get it, I voted for Hillary Clinton and a Democrat. And so the reason why that, not relating to the ACA, is so important is that Mr. Trump received a number of votes from people, when you look at their other views, do not correspond to Mr. Trump. But on the views about abortion, they do correspond for that. So these are the values. It turns out, if I answer the first thing, how do I feel about the Hyde Amendment? Of course, you have to explain the Hyde Amendment. Most people don't exactly go to bed debating the Hyde Amendment. But it turns out, if I think it should be widely available, most people think that the Hyde Amendment should be withdrawn. If I think it's not widely available, should be widely available, I absolutely support the continuation of it. But it's the value that is driving it. It is not the specific policy side. So what I'm going to show you in a second how this plays out in the election. So first, in the election, health care was a second level issue. It's not a top issue. And those of you who have to follow the Post or the Times, will discover that they dropped it from the exit polls. They thought it was so important. There is no health care at the exit polls. So if you just have to write your dissertation on the exit polls, you can just say there is no health care for it. On the way to the forum, I guess they didn't have enough spot on the card, and they just cut health care. But luckily, New York Times and CBS did their own, and health care is the third issue. But it's way down from the economy and terrorism. It's third-level issue. It's very hard to look at that and believe that the election was much affected, regardless of the talks and everything else. For that, I think some House and Senate races may have been affected for it. But where health care mattered is that the country is so polarized about what to do. The parties bring with it baked in different views totally about the future. And they are so far apart, it's incredible. So I'm going to show you that in a second. Let me just deal with Medicare very, very quickly. Medicare is an issue in the election, and I have to tell people this for 94 times. Medicare is not seen as the same type of issue as the ACA. In Ireland, they have a term, things that occurred before the Troubles happened. Let me explain the Troubles. So it turns out, and Pew has done the most work on this, over the last 20 years, forget the Congress, I don't talk about, it's not my business, there has been a polarization. That is, they took 6 areas of domestic area where each says the government should do something or the government shouldn't do something. 15 to 20 years ago, Republicans and Democrats on the 6 were like that. Each year, they edged their way out. There's only one issue left that isn't true. Well, Social Security and Medicare. Medicare is not in that. So I'll show you in a moment, and if you're in the Senate Finance Committee, my apologies. Most voters of both parties think Medicare's working okay. I know that's going to be tough for you, but they were. It's not perfect. They know it's some money, and then we'll show you a list of things to do about it, and on it, we said, what is the top thing you would do? Nobody gets the majority for that. For my colleagues who work on this, the top issue, we didn't get a majority, is incentives to fix health care reform. So it seems more painless than the other. At the bottom is paying doctors and hospitals less. Somehow that has gotten people nervous. In between are a middle, including premium support, which is not a wild success, and it is the one that has the biggest polarization of any issue on the list. So when you look at Medicare, you say, if people actually wanted on a bipartisan way to solve this, I'll show you something, you actually could make progress. There's not this division. The divisions come when it comes to the ACA. And so what I'm going to show very quickly is, on the Republican side, the majority of Republican voters, and with the political work, we were quite amazed. We ran it both ways. You're a Trump voter or you're a Republican. On health care, there's not a big difference. On trade, there is a big difference. So it's very important on trade not to say a Trump voter is identical to a Republican voter. But on health care, we could find actually no statistical difference at all. So we asked everybody what you wanted to do. On the Republican Trump voter side, basically, and this ties back to the value, the majority of Republican voters want out, I call it the Brexit option. They just want out of the ACA. About a third of them know or believe you have to have an alternative. So when you gave them out, give it to the states with less, or here's a tax credit. What is it about tax credits, having actually done a focus group on this, and nobody understood those bills. So what is it that you're picking? You're picking a more moderate involvement of government in your life. That's what you're picking. You're not picking that I like this or that, or I like the credits, and my God, those pools are so exciting for that. So what's very important is, for this reason, we tracked this issue in the Republican primaries, which were 20 months. And there was no advantage for a Republican candidate to offer an option to Republican voters. None. Those who didn't get a single ounce of credit from Republican voters. What they expected you to do was get up there and announce the principle. The principle is we're getting out of Brexit, we're getting out of this, and so that's it. It's a principle that are for that. And so, and they haven't thought a lot about what it would mean the day after. So we're going to do this just very quickly. So this is what a value looks like. Do you believe, and these are all likely voters, that the federal government should play a major role? 87 versus 28 for that. And then watch what happens is if I say I think it should play a major role, 67% says, you know, that ACA is really working well. It is. Damn, it's working well. And guess what? If I say it shouldn't, and you go down to no role at all, 2% thought it was doing something useful. Everybody else thinks it's failing. But it didn't get there because the exchanges didn't work. I'm sorry, you gotta back up a bit here. It got there because people who are on that side are very afraid about the share of government involvement. They're no different than the British who didn't like basically Brussels telling them how to live their lives here. Here is the very point. This was before the premiums were announced. So 68% of essentially likely Republican voters said that the ACA was doing very poorly before the premiums came out. 80% of Democrats said it was doing fine. You can decide who reads what newspaper. Is there a factoid that's different? But that's quite a difference. This is a factually measurable thing, but it's not a factually believable thing. This is just a simple value here. I don't think we need a calculator to look at this, but it just says, do you think it's the federal government's role to ensure that all Americans have insurance? And one set of voters say yes, and one set of voters say no. For this has huge impacts of how I feel about the Medicaid expansion, and this and that, and everything else. This is just the equity argument for this, about whether or not you think the federal government should spend a lot of time evening out the differences in health care between the rich and the poor. If you're in the public side, this actually is the closest that Republicans and Democrats come on an equity question of any question you can ask. About income, it's 70 points different. Republican voters don't think it's the job of the federal government to be evening out incomes. It's growth. Every chart, growth, growth, growth. Not that. So briefly, this is the issue in the election. This is what I call a broad consensus across voters. Come on, somewhere this should be a chuckle. This is from the exit polls. Let me briefly deal with the Democratic side, and you can quote me. Senator Sanders moved the Democratic Party to the left during the primaries. And so what happened both on Kaiser surveys and others, the share of Democrats who said just implement what we have went down. The share of people who said expand it went up, and then when you offered them a government option, and I don't think they know what the government option, they just want the government to play a very different role, really has grown here. So this is the choices here. And essentially, the majority of Republican voters picked those three. The majority of Democratic voters picked the left. Quickly, you can say to me, well, Bob, what happens if everybody elected is just on the right set of bars? I'll let you decide what that is for that. But the thing that you have to understand, and it may change the debate, a very substantial share of Republicans are what I call Brexit people. They're not thinking about the next day. They just want out. They really are angry. They want out of this program. And so what the alternative is isn't a lot on their minds. And I looked at, there are so many issues in Britain, they're overwhelming, and people are saying, I didn't think the banks may leave Britain. I didn't know that. So there's all kinds of things that occur after a vote. But a lot of these people have not thought about that. What's very important on the other side is if there is ever a Democratic Congress and a president, there is going to be a push for a much larger government role, and the next generation will be telling you how the ACA was anemic. It was not enough. It did not go far. Government has to play a much bigger role. So elections here are going to matter over this issue in the future because the parties have no commonality. We decided we would try public option. We had a big debate with Politico about that, and we wrote it as best we could. Why did we have a debate? Because I went on my floor of economists from room to room and asked them what a public option was. I could not get the same answer. So I don't know why I thought a high school graduate would just grasp this right away. But, you know, Hillary had it, it showed up. So what do you see immediately? Throw it out there. Democrat says, absolutely, that's what I've always wanted. Republican says, this is awful. No, I don't want it. So let's say it's not vetted, but it shows just how people are going. And so we looked at the inequality issue, and here is the abortion issue. And what's important to realize in American politics, in 1973, there was very little party difference on that question. There had not separated between parties for that, but it's absolutely there. So if I am in the red, that is my statement. I am not for funding Planned Parenthood. So what I want to take you away from is, oh, it's all about Planned Parenthood. No, it's not about Planned Parenthood. It's about the values people are bringing to this. So quickly, this is Medicare. How's it doing? Oh, well, sure. Everybody agrees to that. Before that, let me just remind you that when Medicare was enacted, just so we know what the other era was, the majority of the public supported it. It had bipartisan support in the Congress. It had co-sponsors who were Republicans and Democrats. And that year was the highest trust in the federal government in 60 years. So people have that, this is before the Troubles. You talk to them and say, oh, I like talking about Medicare. Remember some grandmama who said, keep your hands out of it? Well, there is a bipartisan spirit about where this goes. Here is what do you want to do about it? And you can see there's no grand consensus anywhere. But at the moment, basically trying to do ACOs or anything else that seems to make the system more efficient seems to appear most to voters for this. So is there anything coming out of this election that people, and then we're going to quit, agreed to? And so it turns out that I oppose the government anything in major except in one area. For some reason, people who hate the government are willing to have them involved dealing with pharmaceutical prices at the moment. Now, some of you are going to start snickering, so I will allow that. What are you going to do? You're going to smile and say, Mom, did you see they spent $100 million in California? They depressed the support for this idea? That's not my field. But in the public opinion voter field, there is an issue that cuts across the border. So I'm just going to sum up very quickly. First is the debate we're about to have is about values. And the values are what role the federal government plays. And then on the other side is if I don't want the federal government, and that's what the Republican voter, forget the member, is answering. I don't want them involved in medicine, healthcare, and health insurance the way it is now. So the question is, if they don't continue, do you want an alternative, or do you want to do a Brexit? Let's get out and see what happens and then do something later. At the moment, if you were just interviewing voters, you would be surprised how many Republican voters are not thinking about the it. They don't have the newspapers in front of them for that. We talked about the Democratic side. Basically, if their side ever comes, this will be a big issue and government will play a different role, but not a single payer. I think when you lose a referendum by 80%, it suggests you need another route for that. But a larger role for government is there. Medicare sits there waiting for a painful but easy bipartisan compromise sometime. Voters will not, if you just don't take one thing and penalize them, they will go along with some agreement. Let me quit. Where is this all going to go? What worries me is what worried me about when I looked at the Brexit data. How many people just said, get out, and they did not think about the future. What are the alternatives? And it is very possible that members of the Republican Congress will have people back home who just say, get out. So the latest Politico poll has at the top of the agenda of what Republicans want Donald Trump to do. Quit, that's all I know. Just for those of you who are graduate students, Professor Blendon wrote this 2 ways depending who won. So the other will be published in very anonymously somewhere else, what this speech would have been if we would have talked about Hillary Clinton's first 90 days. But it's not. We're open for questions wherever you want to go, except how we got here.
Thank you so much, Bob. Wow. So, you know, I'm going to ask Bob a question, and then we'll open it up for the audience. We will have staff coming around with a mic, so if you do have a question when it's time and you want to raise your hand, please just introduce yourself, and if you could try to keep your questions as brief as possible. That way we'll get to as many as we can in the next 20 minutes or so. So Bob, you know, you talked about essentially the polarization and the sense that, you know, there wasn't a lot of expectation amongst the repeal voters for any kind of a replacement plan. So now it is the morning after, the week after. How worried do Republicans need to be about creating a replacement plan? And if so, how does that play out over the next, you know, 100 days, over the next Congress?
A problem about teaching politics, but even though I couldn't predict either one of these elections. So my view is a moment where 20 million people ever lost coverage is a political disaster for either party. So I just can't imagine that if I was thinking about the next 4 years and all, that I would ever want a moment where you had that. So the issue that people who think ahead is how can I transition out to where I am, where we're not talking about 20 million people losing coverage, but they're not, what ends up does not look like Obamacare. And here I just have to say, when you have this really wide split, there are a share of people who, while others will just have tears in their eyes, want to be screaming at night, we got rid of it, we got rid of it. So it can't be, people keep emailing me about small modifications that the Republican leadership will make to the ACA. And I cannot see how that could be possible for them to go back to Wisconsin and Ohio and everything and say, we made some small modifications. So somewhere in between not getting rid of it and others. Let me make a statement, because it's in between. We have reached the stage that Medicaid per se is nowhere near as unpopular as it was 20 years ago. That's true for Republicans, et cetera. So the expansion issue has gotten caught up with the ACA. The only thing you could make a Republican governor do is do that. But the polling on Medicaid is quite mixed. I don't think people envision lots of people losing Medicaid coverage, nor if you listen to the president-elect at times, that didn't sound like exactly where he was going. So there's a separate issue about what happens with Medicaid and Medicaid coverage. But the issue that will really bother conservatives are mandates. Mandates on having to buy insurance, mandate on what the policy looks like, mandates that business have to contribute, and I think it'll be very hard for them to keep that. At the same time, they're going to surely have some terrific economists figuring out how people with very serious diseases don't lose coverage. But they cannot keep the mandates. The fact is, it's the only way the pool works in an economics class. It does not work in a politics class. If you really are anti-government about the health care issue, the mandate thing really bothers you. And that is their constituency.
Do we have a question?
I have questions, but I'll let it take yours.
Hi, Daniel Davis. 2 questions, because I think, and you sort of touched on it, but on the other side, I think on pre-existing conditions, which is a population that that I work on, there is a significant question now. The president-elect talks about preserving pre-existing condition coverage, but essentially, as you said, getting rid of the mandate. I know a lot of economists and have questions about how that's possible. I guess the question is, did you poll at all on how people felt on both sides felt about the pre-existing condition protection itself, because that issue seems intertwined? And then the second question is, there's a lot of things in the ACA that, like long-term care reform and prevention, that have very little to do with government mandates. Where do you see those factoring in?
So I have to be very careful. People who study public opinion should not be allowed to answer questions when the public wouldn't know was in the bill. So you get into these big discussions as if they knew, they might have thought. So the two most popular things, and this is the Kaiser is there, has to do with keeping people, kids age 26, and pre-existing conditions. The problem is buried in another poll result, is how much people hate mandates. So the person that I would be interviewing on the Topeka Turnpike would say to me, I want those pre-existing conditions covered, but this mandate stuff, that's awful. And that's why it's very important to remember some people miss graduate school. And so how this fits with that, and you need that in the pool, that's not the people I survey. The people I survey are not in the pools, but they are, and they think it's wrong for that. So it's going to be very hard to walk away from the principle of doing something about it. But the policy, and I follow everybody's blogs and everything, how that'll work, and that's what the other discussions will be. But the two things that are most visible, and President-elect Trump picks up things that, as he says, I see on TV, people don't like pre-existing condition exclusions, and nobody wants to drop the age 26. But how to make that work in a different arena, that's where it is. And if it doesn't work, how to make it so that average people who care would understand that. And that is a real problem with a lot of we work with, that people believe in the goal, but you change things and they don't, there's no way to know the it is really seriously flawed. But as a principle, those two principles, the president-elect was right out there in a second. Likewise, he said the poor are not going to lose coverage. Nobody is on either side is for that. But a lot of the things in the bill may be very, very important to people who work in the field, but they are unknown to constituents. So that's what lobbying is about. When if there's a bill with a different name, is it in or not? But the people that we would survey would not know. By the way, I'd rather be in the audience asking questions than particularly this issue where I have to answer. But I had a great other talk, I promise you that.
Sir, me?
I think I saw Krista first, and then Mike.
I'm Krista Droback. So let's say we have guaranteed issue and no mandate, and we have a death spiral with 30% increases in premiums in the individual market. Is there a point at which you think that some voters, maybe not on the extreme sides, but in the middle, would say, now we need a government solution because we've seen the market not working continually?
So it would have to be a much larger, this is a real broad debate philosophically. And Republican conservative voters do not want to wake up in the morning with a big government solution, particularly now they believe they've won. And also, it's not my job to tell you this, but they think 2018 is going to be an incredibly good year for Republican candidates in the Congress. And unless it really is going to drive potential voters away, they're not going to be instantly responding. At the same time, these issues build up over time. But I think anybody involved would prefer there's some way to do this. But it's very hard when you just interview people who say, I went out of this thing and I hate mandates. for this to say, but you have to put up with this mandate in order to get this done, then I'm back to the Democratic side of my interview. So I don't think alone that's going to drive that in the short term. But there will be a lot of effort to find some way to deal with part of those issues so you don't read about it in the front page of every newspaper.
Thanks.
Hi, Mike Miller. I wanted to go back to slide 5, maybe, where you talk about the question, how well is the ACA working? And the stark difference between Democrats and Republicans. I'm wondering if you asked any sort of second-level questions, because I'm wondering if the Democrats looked at the ACA and the patient protection side and all the people who got insurance and Medicaid expansion, and they thought that was a great thing. And the Republicans were like, but the affordability, affordability, schmortability, the costs are killing us, it's a horrible thing. Was there that kind of split, or is it more simply the government role, the mandates you've been saying?
So first, and I try to divert the anger from me to the broader people involved in this. In the surveys that were done, which asked people if they benefited by this, and I want to be very careful because I was attacked by a whole group of conservatives over my answer to this, the majority of Americans do not believe themselves were helped by this. And actually, which they will point, if there's somebody from one of the conservative groups, they'll say, Blendon, you either tell us or I'm going to put it in the front page of Heritage. More people said on the surveys that they were hurt than helped in the ones that we were involved with. And so where I got caught, I said most experts believed that middle-income people were helped by this bill. I had a whole stream of emails which said not. So I now can say some experts on my floor believe that middle income, but there is not a recognition, and you can have a discussion, is this an education failure by people who are advocates for this? But if you had the response to Medicare by seniors that we have here, we'd be looking at some tiny program. And so the ability for people who believe that they should have, or we believe might have gotten some benefit, they do not see they got the benefit. And they do see they got the premium in cost. So among middle income people, there are not a lot of people saying that they got great benefits out of this law. And so when you're saying you're changing it or you're rolling it back or scaling, a lot of them are just going to say, I'm worried about the premiums and I don't know what I got. And you can scream and yell at me, but they got this and this and this, and did you read page 244, and they got all these additional benefits, but the people surveyed do not report, particularly middle income people, that they know they got those benefits.
Thanks. So very interesting conversation about the correlation, if any, between the views and the values and people's actual experience of the law. And curious if there will be more research on that and what that will bear out. What do you think?
At least for a moment in a polarized world, we have become dominated by values. And I'm trying to fight this because I've been on 3 panels where people say, tell them, Bob, we're in a post-evidence world. I'm not willing to say that yet. Where you can just assert nobody benefited. Everybody sits there and says, yeah, I guess that's true for that. But the values are much more dominant than this. We're not getting the Medicare response. We're not getting millions of middle-income people that say, this is really terrific for me. For that, that could change, and it could change if a lot of people lose coverage. But at the moment, this battle really is about philosophy and values for that, and people saying, in my world, I didn't get a lot out of this thing, and so I don't feel very strongly about it. On the Democratic side, I want to give absolute recognition. Democrats care about the values involved. They want to cover people who don't look like middle-income Democrats. It's a values issue. They absolutely do. They want the government to protect people who are not them. So this is really what the value debate is really about for it. But the course that some of us took years ago called the end of ideology and then we could move on is not true. It didn't end. And it clearly came out in this election, and it's going to come out in a debate about what happens to the ACA. Many people will get emotional, not based on how it works, but their view of what the government should be doing in this area over the next 4 or 5 years.
Thanks, Bob. There's a question from Paul and then back.
Thank you. Paul Cotton with NCQA. Struggling to find some consensus here. I noticed on your third to the last slide, how to address high healthcare costs. The top answer there was the incentives to provide high value,
No,
efficient
that's
care.
Medicare.
Yeah.
Medicare is in a totally different package, whatever it is here.
Okay.
Come on, where's Medicare? There it is.
Yes.
So that was all around Medicare.
All right.
It's working, bipartisan, the agreements, people just feel differently. They are answering a different question. Medicare in politics is on Mars and the other is on the moon for that. And we try to wrap it in. But for those in the Congress who decided they want to fix the ACA and Medicare at the same time, just free advice, buy some other insurance, because it's not going to play out well. People have a protectiveness about Medicare and Social Security that's quite incredible. Just, you say to them it's in trouble. Yeah, it is. They're not going to touch it, are they? And just remember, on the Republican side, the base that they have are growing are age 50 and up. These are the recipients of retirement programs. So putting Medicare in with ACA issues or Medicaid is not going to be smart politics. Medicare is a separate issue, as is Social Security in the American mind.
So my
Great.
Since the British are a few months ahead of us, are there any lessons learned from Brexit that we can apply here?
The lessons they had to learn, since they were speechless, having spent an evening with this, is that you have to have alternatives that you can put on the table. So if you actually watch The Economist, they're trying to exempt some trade agreements with the European Union. They're trying to have some wiggle room from this that allows you to have a different set of role. And so if there is some sudden big change here, the real question is agendas to pick up pieces of this that can carry on. The big British problem is don't wake up in the morning, never thought that this could happen. So you haven't given any thought to how you could adjust to this. And in this regard, these issues are going to play out in this new Congress with this new president. You can't escape it. But thinking about some of the options which aren't exactly continuing where they were going.
Question over here? No? Oh, sorry.
Oh.
You go ahead and then.
Okay, thanks. Hi, Amy Grace. Thank you for an excellent presentation. I was just wondering, in terms of the popularity of Medicare and also the unpopularity of a mandate, whether, again, trying to find common ground, if a public option were framed like a Medicare buy-in, do you think that would go over better with voters?
I think particularly, so they're not going to go over better with Republican voters, so let's agree to that. But I think what's going to happen in the Democratic Party, there's going to be a lot of effort to rethink what is it that we stand for in the next round. And it may include that, but people are going to have to understand what it is. What it's clear to me is that Democrats want basically government to be in the middle of this. So if you're a Democrat and you read that Tennessee has only one insurer left, your feeling is, why isn't the government doing something? That's what you will be. Well, in a Republican, you say, make the market easier to work. So there's going to be a lot of rethinking, and that's where groups are very important. What is it that Democrats could be for that might have a much more visible role for government without saying, oh, no, we're going to have a Medicare for all, because I don't think the politics is going to play there. But I think rethinking that for that, and the mandates all make sense from an insurer's point of view. It's always been politically difficult. We did a lot of the polling in Massachusetts, and every point I always made is Massachusetts is a state that requires kids to wear helmets on the highway, fire extinguishers at home, and it was the lowest ranked thing when we surveyed for it. And everybody said if it worked in Massachusetts, it'll work in Mississippi. And I scratched my head. I don't know, they don't wear motorcycle helmets in Mississippi. That just was all the things the Massachusetts plan that ranked lower. There was a real concern, even among Democrats, among that mandate. And I know it made sense insurance-wise, but it had a real political side. and people have to rethink about what some of the options will be for that. But again, it's like with the Brexit vote, it isn't over till it's over. So there'll be a big debate in Congress, and there are things that can be negotiated. But if it doesn't go that way, then you really have to think about other alternatives that will play better with some of these voting audiences.
So there's one more, we have time for one more question, and then I'm going to ask you a final closing question before we round out the panel.
Hi, yeah, I was just wondering if there's any research behind what the value-related, because you talked about how values are super important in this election, the value-related support of Medicare was. Is it just taking care of older people, or is there something else there that leads people to be more in support of Medicare than the ACA?
Yeah, Medicare is built on the most successful domestic program, which was Social Security. And it's a retirement program, and we'll reduce this very quickly. People are not as in love with how Medicare works. There is a feeling that it's the Medicare working that they love. They actually don't. There's over a third of people have signed up for the private option among younger people. It is security, and they like the principle of paying through your whole life and when you retire. That is incredibly important. Having had focus groups, and I say, what is it, why are you so against this? They said, you know, all these people are getting, and they didn't pay for that. And so the Social Security thing, and if you're again on the finance committees, only you and I will know they think they pay just enough that it's already taken care of, and only you and your shrink can figure out how you're going to tell them that what they paid in the Medicare isn't enough to cover what it is. But most people believe that what I paid in is enough there to take care of me when I retire, or mom or something. But it's the payment in that really, and the earned side of it. And it's for retirement. It's not for the whole healthcare system. But it is incredibly, the in-depth support for it is just incredible, and nothing runs against it the way Medicare does in the political arena.
Great. So let me pick up on what you were saying about, you know, finding some alternative solutions. And you know, we've been pretty much since the enactment of the ACA kind of in this a little bit of a deadlock of, you know, we can't fix it unless fixing it is repealing it. And then there's, you know, there's people, I think, from both sides of the aisle that would like to, you know, fix things about it to make it better. I mean, obviously, we're now beyond that kind of conversation. My question is this an opportunity for fresh thinking on both sides of the aisle, or are both sides of the aisle just going to become more entrenched as a result of this election and the polarization? And do you have any comment on that?
In the short term, they're going to be much more entrenched. And so this is not the audience. For this, there's something wrong with the U.S. primary system. The primary system went 20 months. Only 20% of American adults voted in it. And if you're running, you spend your life running in these primaries. And the primaries force you to take positions which are very hard to then sit down and say, now you and I are going to negotiate our way out of that. It's very, very hard. And the primary thing is very, it really worries me, because by the time the primaries were over, people were so locked in. And this idea, okay, now it's May, and I'm going to say, you know what I said? I don't believe any of that. I'm really moving to the center. That's not possible after 20 months. We have to do something at the primary system which essentially has a broader range of people voting, so we're not as polarized. This is very, very serious. All the things we discuss, if there was some bipartisan way to have a discussion for this, could move ahead. But it's going to be very, very hard for many members who were elected, particularly with President Trump, to find that they're in bipartisan discussions. It's just they're going to say, it's better that I stay where I am staying. Mm-hmm. And for Democrats to say, I'm in opposition and for that. But hopefully we can find some way out of this, because this polarizing on every issue makes no sense as a country. It's embarrassing. And because I only do health policy, I sneak up and I look at this, well, they must agree on education, right? No, they must agree on climate change, right? We all agree as a nation on climate change. And then you go up again, well, they must agree on what to do about the poor. Well, no, they don't exactly, mostly. And so we just can't keep going on with all those boxes. But we are stuck with this after this election that we shifted, and many of the voters have strong views. And a lot of people say, well, they ignore it, but it's going to be very hard to ignore when the president-elect talked about it so much and the various leaders of the Republican Party did, and the voters on their side were so quite extreme. It's going to be very hard to walk away and say, we're really going to work on another issue. I think it's going to be a front and center issue.
Thank you, Bob. Well, please join me in thanking Dr. Bob Blendon.
I don't know about you, but I'm going back to London to work on this.
We are going to move straight into our next panel. And just a reminder, if you want to use the hashtag Health2017, if you really need to, you can go out the back, and the restrooms are out in that corner. Thank you.